What kind of things does a PT student do at a facility like this?
Our space is unique because we're a unique profession, right? We don't just sit in a lecture hall all day long learning. We're up in movement because movement is medicine, right? That's our whole kind of philosophy. If you have tried to navigate the landscape of healthcare, it's sad. So I have parents that are aging and seeking out healthcare, and we have had to travel hours and hours away just to find adequate specialists that can treat the issues that they're having. I work with a lot of kiddos that have type 1 diabetes. That's a condition we see in pediatric populations. There is not an endocrinologist here in the Fort Smith area. They don't exist. So you have to travel outside of the area. I have people contact me all the time and they're like, hey, I need to see a physical therapist. And some of the clinics here in the area have a 3 to 4 month wait period. And if you're in pain or dealing with a surgery that you've recently had, you can't wait 3 to 4 months. Right. So slowly we are starting to see the fruits of our labor, right? We've graduated 2 cohorts now. And so the landscape is changing. It's just happening at a pace that we're trying to manage and trying to fill that gap.
Well, hey, welcome back to the Discover Fort Smith podcast. My name's Josh Bufink. I'm with the city of Fort Smith, and sitting next to me today is my lovely co-host, Ashley Backert with Discover Fort Smith, the Convention and Visitors Bureau. And today on the show, actually, before we go any further, we're actually filming at the Arkansas Colleges of Health Education. We're in the Health Sciences building out here on Chad Colley Boulevard in the Chaffee Crossing area. Very thankful that they allowed us to use this lovely space to film in today. And with the Arkansas Colleges of Health Education, we have a guest today, Allie Young.
Hello.
Allie, thank you so much for being on the podcast.
I'm excited to be here. Thank you.
So tell us a little bit about your story. How did you end up in Fort Smith? Are you from Fort Smith?
Sure. It's kind of a long one,
okay.
But I grew up in the Fort Smith area, right down the road in Greenwood. I moved away for college because this beautiful building did not exist at the time. So I moved to Central Arkansas to pursue my Doctor of Physical Therapy degree. So after that, my husband was a coach for Russellville School District. So we kind of settled there, and I practiced clinically treating pediatric patients for about 8 years.
Okay.
And we were happy there. Life was good. We had 2 little boys. And then my mom, who still lived in the area, started sending me these articles about what the college was doing here in the area, like little subtle hints, right? Like,
Yeah.
hey,
Come
look
back
what they're
home.
building out here. And so, of course, she
Isn't
had an
this so interesting?
of course, she had an ulterior motive because I had her 2 grandbabies.
I was about to say, get the
right?
grandbabiys closer.
And so I'm like, what is she like? I'm not a professor. I don't teach. I work in the clinic.
Mhm.
And she just kept sending me stuff. And so I kept getting more and more interested. I would see on social media what was happening out here in Chaffee. And I'm like, okay, let's think about this. So at the time, I was in the clinic treating patients, but I had started taking students as a clinical instructor, right? And so I kind of started to find this new love for teaching.
Yeah.
And so I thought, you know what? Maybe I'll just reach out. Maybe I'll just see what they're doing there. So I had a couple of connections at the college. And so I reached out just kind of looking for more information. Like, what are you guys doing? What are you guys building over there? And the program director at the time for the PT school invited me down. He was like, just come see it. Just come see, come talk to us, see what we're building. And so I'm like, sure. So we were on our way to a wedding up in Northwest Arkansas, my husband and I, and we stopped at the college, and he took me around. And at the time, this building did not exist. And so he took me around, and it was still in the development phase. Like, you had to wear a hard hat to get in here, right? And so he told me all about what they were building, the mission of the school, and I was hooked immediately. Of course, it's beautiful. It's a beautiful building. It kind of sells itself, right? But then I think the coolest thing to me was just the mission that they were serving, and the opportunity to connect in a community that I loved is what really drew me in. So fast forward, nothing really moves fast in education. And so took a couple of, years. I think it was like 2 years. I had my youngest son in the meantime. And finally, it all worked out, and I joined AIC in the summer of 2021. And so I've been here about 4.5, almost 5 years.
Nice.
And it's just been a wild journey since then.
Nice. So what have your roles been with AIC
Mhm.
during that time?
Yeah, so I started as an assistant professor, which I still am. And so I teach some of the first year content, like their Foundations of Physical Therapy course. So I teach how to use assistive devices, how to do transfers, how to teach gait training to a patient, those sort of things. I also teach the pediatric content. So
Okay.
birth to 21 years old, I teach our students how to work with those patients. And then since then, I've also moved into clinical education. So I now serve as the director of clinical education,
Nice.
which just means that I'm responsible for placing all of the students on their terminal rotations. So their last almost full year of physical therapy school, they actually spend learning how to do the job of a physical therapist. So I place them in those clinical rotations with licensed physical therapists to get that external education piece of it.
Wow. How many students are there in the PT program?
So our
Sorry, I put you on the spot.
No,
Just
you're good. No, you're good. It fluctuates a little bit year to
Okay.
year, but our cohort size is 40, and so we have 3 cohorts at a time, so 120
Okay.
students.
Wow.
That's
Larger
incredible.
than I thought, honestly.
And they come in from all over the country.
All over. So
So
we try and serve, we have our service area, right, which is Arkansas and then kind of all of the surrounding states. So we see a lot of students because our mission is we want to train these individuals to stay in the area and serve these rural areas. So heavy on our Arkansas students, Louisiana, Mississippi, Texas, Tennessee, Oklahoma. But then we do have some students, we've had students from Florida, from New Jersey, from California. Some of them have fell in love with the community and decided to stay here, which is amazing.
Awesome.
Some of them have returned back home to serve their communities, which is cool too.
Yeah. Yeah, so that mission is to serve the rural areas. Is that an issue that we're seeing right now in the healthcare industry?
Absolutely.
Okay.
Absolutely, especially in this area. If you have tried to navigate the landscape of healthcare, it's sad. So I have parents that are aging and seeking out healthcare, and we have had to travel hours and hours away just to find adequate specialists that can treat the issues that they're having. I work with a lot of kiddos that have type 1 diabetes. That's a condition we see in pediatric populations. There is not an endocrinologist here in the Fort Smith area. They don't exist. So you have to travel outside of the area. I have people contact me all the time, and they're like, hey, I need to see a physical therapist, and some of the clinics here in the area have a 3 to 4 month wait period. And if you're in pain or dealing with a surgery that you've recently had, you can't wait 3 to 4 months.
Right.
So slowly we are starting to see the fruits of our labor, right? We've graduated 2 cohorts now. And so the landscape is changing. It's just happening, at a pace that we're trying to manage and trying to fill that gap.
Right.
I think I ended up having one of your cohorts during physical therapy after I tore my Achilles. And they were going through, and I will say, absolutely phenomenal. I mean, they were very caring, asking a lot of questions, but knew exactly what they were doing.
I love
A little
that.
bit of that free reign. I think they were towards the end
Sure.
of their rotations, stuff like that. So they were like, yep, just go ahead and work with her. And I mean, such great kids.
that.
And I think anytime you get the opportunity as someone in the medical, like if you get students in with you, like be patient
Mhm.
Absolutely.
sometimes, but know that like you're going to be a part of their story, which is kind of cool too.
It's
Right.
very cool to be a part of. Absolutely.
Right.
Thanks for sharing that.
Oh, yeah,
I love
and-
that.
And the facilities here are phenomenal. You guys have
Amazing.
some incredibles. What kind of things, what kind of spaces, what kind of things does a PT student do at a facility like this? Like
Yeah.
I'm assuming they're working on dummies or something like that.
Yes,
So-
we have the mannequins,
Okay,
the high
mannequins,
fidelity.
yeah.
Yes. So our space is unique because we're a unique profession, right? We don't just sit in a lecture hall all day long learning. We're up in movement because movement is medicine, right? That's our whole kind of philosophy. And so all of our labs, our main lab spaces are just big open rooms.
Okay.
And you'll see they're divided. Half of them are the seating area where you can sit for traditional lecture. But then the other half is what we call like our neuromat tables or our plinths, which is our big tables where we do our actual treatment. And so, our students might be scheduled for like 3 or 4 hour blocks of a class, which sounds really intimidating to sit in a musculoskeletal course for 3 or 4 hours. However, you might actually spend like an hour sitting down and listening to a lecture, but then you immediately get to go to the other side of the
That's
classroom
cool.
and practice it. So when I was a student, that wasn't something that was available to me. We were in a smaller space, and so we had to divide all of our labs up. And so I might have the lecture on Monday morning, but then I might not get the lab that goes along with it until Thursday afternoon. And so there's kind of that big disconnect. So that's one of the things that I love most about the space that they built here. They were very intentional with the designing of that, and it works out beautifully.
Oh, that's awesome. So you kind of specialize, from what I'm hearing, in
Yes, I
pediatric
do. Yes.
physical therapy. Do you do? I know you do a lot here at the college,
Mhm.
but you also do some other stuff on the side.
I
Is that
do.
correct? So, like,
Yes.
explain some of that.
Yeah, absolutely. So pediatrics is my passion.
Mm-hmm.
I've been in that area since I graduated with my degree. One thing that I really noticed as I am a mom myself,
Mm-hmm.
and as I'm connected to a lot of moms in the community, is just kind of that gap that exists with navigating what to do with your baby, especially kind of in that first year of life, right?
Mm-hmm.
So a lot of people just simply don't know, when is my baby going to be able to sit up? When can they hold their head up? When should they be crawling? When should they be rolling? All of those milestones, there's just not a lot of education out there on that, right? Like when a mom typically goes in to have a baby, they speak with their OB, they deliver the baby, but then there's nothing about the baby, right? It's all the
Mm-hmm.
mom's care. And then you go to your pediatrician and it's about their, are they gaining weight? Are they meeting these milestones? But there's no actual education on what achieving those looks like. What's
Yeah.
appropriate to work with those babies? How do I teach my baby to crawl? What does that look like? And so kind of a passion project, I started developing this platform of connecting moms or first-time parents or any sort of caregivers who are interested with each other to be able to share some of these milestones, but also a way that they can educate themselves on evidence-based practices that are best for reaching those milestones, right? So I developed this app called NurtureWell, where you can go in, you can set up a profile for your baby and their age, and then it will tell you exactly what they're supposed to be doing at that age, right? So if my baby's 6 months old, I can click on that, and then it gives me a list of milestones. So their physical development, what they should be doing, their social emotional, their feeding, their cognition, what are the things that I need to look for? And then my favorite part is that it has red flags. So if your
Yeah.
baby's not doing something, this is when I need to seek help or talk to my pediatrician. And so I've been working on that for probably the past year now. And so it's really cool to see that come to fruition
Yeah.
and now be available in the App Store and the Google Play Store to get out there to those moms.
Yeah. Man, I wish I had something like that
It's
whenever.
like literally a
Yeah.
kid handbook, a parenting handbook.
Yeah, because you go
Where
to the
were
doctor.
you 15
Yeah,
years ago?
yeah. You go to the doctor and you get this list and you're going through the list and you're trying to see if we've met the milestones or if we're on track or whatever. And some of the stuff I'm like, I didn't know he was supposed to be doing this.
No one told me
Like,
that.
I don't. Can he do that? Then we're sitting there having a conversation, like trying to figure it out. And then what do we do if he's not? Or
Right.
so that's
Or
man,
you're given like the book that you can read through with
Yeah.
all this extra
What-
time
yeah,
you
what to
have.
expect
What to
or-
expect in the first year. And I'm like, am I supposed to expect that I can read this in the first year? Like,
And
that
you
too.
you
Right.
said something about crawling. I was thinking, that's I would think that's just something that they do at some point, right? But there are actual things you can do to help them achieve
Absolutely.
that.
And that's the problem with like today's, there's so many gadgets and contraptions or containers out there.
Mhm.
We call them containers in our physical therapy world. That help these moms, right?
Mhm.
Carry on with their busy lives, which are great. And I'm a firm believer in all things in moderation, but they don't come with instructions like that, right? So
Mhm.
nobody really knows, like, well, how much time is it okay to put my baby in the swing? Or how much time do they really need to spend on the floor in tummy time? Everyone talks about tummy time, but is there a rule for that? And there's evidence-based rules for that, for how long you're supposed to be doing that. But you just don't know if you don't know, right?
Right.
And so that's what's cool about the app is everything is in short form content. So there's really short videos that you can watch. Or if you don't have the time to watch a video, there's articles or infographics, things like that, because nobody has time to sit down and read a long book, right?
Yes.
So that was kind of the goal of it, was just to make it easy to understand, digestible pieces of information that are helpful for people navigating that new chapter in their life.
And it sounds like it's kind of personalized too. So you're not like hunting around for the information
Absolutely.
you need.
Yes, we
It's
try
like
and make it
pertinent.
as easy as possible.
Yeah.
That is so cool.
Yeah,
That
Like
is-
right here in
you.
Fort Smith. Like, love it.
That's awesome.
Thank you.
So they could just go on the App Store and
It's on the
download
App
that. It's
Store.
already
It's
there.
called NurtureWell.
Nice.
There's a free trial and then a subscription if you want to subscribe to some of the premium features.
That's really cool.
Yeah.
So obviously, that's technology at work and stuff like that. So I think in general, how are you seeing PT, pediatric, like all of this, how are you seeing technology playing roles and changes into how all of this works?
That's a good
That's a
question.
great question and a conversation that is actively occurring across our profession, right? So I love physical therapy in the field of physical therapy, but one thing I will say that came out of COVID is that we kind of learned that we are a little behind in the world of technology and the digital age. And COVID taught us that real quick when we had to pivot everything to technology. And physical therapy just wasn't really a practice that was set up for that. And so there's been kind of a scramble or a mad dash to kind of fill that gap and how to serve technology in the field of physical therapy. And so it's changing every day. One thing that we're seeing right now is the use of AI to help with documentation. So there's a ton of burnout across all medical professions, right? But especially in physical therapy, because you spend so much one-on-one time with your patient, but then what the patient doesn't see is that you have to go back to your office and document all of that, right? So if you want to get paid for it, you have to document that so you can turn it into insurance and get reimbursed for those services. And that can take a really long time when you've spent 30, 45 minutes or even an hour with that patient to outline everything that you've done. And so AI is something that's, being explored to fill that gap. And so using AI to increase the efficiency with documentation, with billing, with things like that, so that PTs can really focus more on that patient care and that specialized treatment that we love about our field, but still, reduce that burnout and increase their efficiency.
Nice.
Very cool.
That's awesome. I think most fields are seeing AI play some sort of role in what they're doing. Is there anything like within AI, and we may cut this out, I don't know, Joe, but is there anything like within AI that kind of worries you for the field going forward at all?
Yeah, absolutely. I mean, there are so many trainings, and I've done so many trainings on like the ethical use of AI, right? And HIPAA compliant, protecting patients with the use of AI. And so it scares me, but the more I learn about it, the more confident I become in the technology and the way that they are using it. So that is so above my level of technical abilities, right? But it is cool to hear all of the ways they are still being HIPAA compliant and still protecting the patients ultimately. I think, we live in a time where, there's always the risk of technology and hackers and things like that. But it is cool to see that they're really doing their best to protect the patients.
I think unknown, uncharted territories just generally worrying for people at first, but we tend to get used to things over time and realize, well, maybe it really wasn't as bad or as dire as we originally or initially thought.
Right.
So,
I was talking to a friend, and she said that she got to use AI for the first time to kind of scribe and do her documentation. And I was like, oh, what did you think? And she was like, I left on time today for the first time in my entire career.
that's awesome.
And that's huge for these people that work in healthcare and have families or just want to get out of there and take a break from their job, to be able to leave on time. When you work from 8 to 5, you don't realize how long they're staying after hours to finish that documentation. But you have to do it. It's a necessary part of our job, right? And so she told me they ask consent. So if they're doing, it depends on the device that they're using, but this one specifically listened in to the treatment or the interview process and then scribed that for them and put it into a format where they could use it. And so, of course, you have to get consent from the patients. And a lot of the patients were on board and willing to try it. Of course, there were a few that were a little skeptical, which is fine. And I
Right.
think that will get better with time. And the more we learn about it and how to educate our patients to ensure them that they're safe and that their data is protected, I think will help advance that. But I thought that was a really cool story for her to share, that she got to go home one time.
Yeah. Is burnout an issue in the physical therapy
Absolutely.
field? Yeah.
Absolutely. It's a conversation that happens every single day. The big conversation right now is the cost of getting your DPT degree, and, the loans and paying that back, and how do students pay that off without working 80 hours a week. So it's just a conversation that is always ongoing.
Now, are you guys having these conversations in the classroom as their students
Absolutely.
about how are you mentoring the next group
Yes.
to say, hey, this is likely going to be a thing, but what are you telling them?
Yeah, absolutely. I think transparency is the best policy, and having these conversations. I also always try to lead by example. So early on in my career, I feel like I was just hustling, trying to pay off my loans, trying to get everything done that I could. And I did experience that burnout really quick. And that's when I started to maybe look at a career shift. And I'm glad that I managed that and ended up to stay in the profession of physical therapy. But I think it's something that all new clinicians go through. They're like, man, I'm just really tired of working with patients all day, but I've got this student debt that's hanging over my head. And what do I do to combat that? And so, I always try and lead by example. And so talking to students about work-life balance and demonstrating that you can still have fun and you can still live your life outside of your work, and how to be efficient with your time and time management, what that looks like. We use a coaching model as well with our students to mentor them kind of through physical therapy school. And that's one thing that we're constantly checking in with, how is your mental health? How is your burnout? How are you managing this? And then how are you going to manage it once you leave us and you're out in the real world? And so it's conversations that we have all the time, try and give them the skills that they need and the tools that they need to be successful with that.
Yeah. Those skills are going to serve them well for years to come.
Absolutely.
As they, face, peaks and valleys throughout their career and having families and stuff like that. You did mention work-life balance. So we're going to talk a little bit about, we've talked a lot about work. Now we're going to talk a little bit about life outside of work.
Perfect.
So what things do you and your family do in the area? Say, are your kids involved in sports, those types of things?
They are. We are. What I think is very involved in the community. And I will say that has been the best part about moving back to Fort Smith. So I have a pretty good mix of some old friends that I was able to reconnect with, but also the community that I've built since moving to Fort Smith, and people that are transplants new to the area, or maybe have always been in the area and just haven't really connected. The community that we built is probably one of the things that I am most proud of. So we have so many things that we love to do. Riding bikes. My family is big into biking. And so, everyone kind of talks about Northwest Arkansas and how it's the gold standard for bike riding. We have a lot of fun here in the area riding some of the bike trails. So down at the Riverfront, if you're looking for just a nice, easy trail, we love to go down there. When my boys were younger and just starting out, we spent a lot of time out there. We love to ride through Ben Garin, over in Barling, the Celebration Park, and around this area. So biking is one of our favorite things if you're looking for something outside to do. We also love a place where you can take your kiddos and let your kids be kids while still enjoying, a nice meal or hanging out with your friends and talking to them. So Connex Bar is one of our favorite places.
Oh, yeah.
We love going over to Connex. They'll have a big bounce house for your kids to go and play in.
Yeah.
And they've got bikes and bago and things like that where your kids can play. They'll bring in different food trucks. So we love texting our friends and being like, hey, meet us at Connex. The kids need to get some of this energy out.
Yeah.
And then we can just sit and observe and have a good time. So that's one of our favorite places. Hideaway Pizza, we find ourselves there a lot because
I'm a
the
big
dough.
fan.
Because the dough.
I know.
That's what he talks
They
about
bring
too.
out the dough for
Listen,
your kids.
The watchers and listeners of this podcast know that I love Hideaway Pizza. So sorry to interrupt
That's hilarious.
you.
That's one of our
Yeah.
favorites too. We love going to La Huerta downtown, sitting on the
Yeah.
patio because again, the kids can hang out there. We love going across the street here in Chaffee.
Yeah.
We'll go to Las Americas sometimes and we'll sit outside and let the kids go hang out in that lawn space. We'll bring
Mhm.
football, something like that for them to play with.
Mhm.
That's some of our top spots that we love to visit. As far as things to do in Fort Smith, so my brother was just in town. So, of course, he grew up in this area, but he now lives in Spokane, Washington.
Okay.
And he's been there for the last like 15 years. So he comes back into town to visit periodically. And he was here for Thanksgiving break and like, what should we do? Where should we go? And so we took the kids. We kind of did like the tour of parks because there's some amazing parks and playgrounds here in the area. They love John Bell Jr. Park, which they call the Blue Park.
Yeah,
So
yeah.
they know them by colors, right? They're like,
Right.
let's go to the Blue Park. That's the one downtown. They love the zip line and the swings and all of that. They also love what they call the Green Park. So Celebration Park over here
Okay.
is
Yeah,
part
this
of
one's
AIC.
gorgeous.
They love to go to the Green Park.
Yeah.
And so we did the kind of the tour of parks. We also did the Fort Smith Museum of History. That was really cool.
Yeah.
My kids are at an age now where they can start to appreciate that and love the stories that we tell them. We did the Marshall's Museum. That was a fun one. We did the National Historic spot down there on the river.
Mhm.
And we got to see the hanging
Yeah.
judge and the
Mhm.
courtroom and all of that. That
Gallows,
was really
yeah.
fun. So those are some of our favorite things to do in the area. But I will tell you, my latest hobby. Have you guys heard of mahjong?
I have.
Have you played mahjong?
I have
have not.
never played mahjong.
Have you heard of it?
I have definitely heard of it. Yeah,
Okay,
yeah.
so mahjong is this game that's like taking over by
Mhm.
storm, right?
Yeah.
So it is a tile game. I don't really know even how to describe something similar. It's like a combination of, I don't know, maybe dominoes with like card games, but there's strategy involved. And so there's this big community of individuals that play mahjong. And so I've
Yeah.
kind of gotten drugged to a few mahjong events. They're like, hey, come play this game with me. But it's really, really fun. And so I've enjoyed getting to do that and connect with a lot of different people from the community,
Yeah.
a lot of moms. It's like they'll put their kids to bed, right, and leave them with the husband. And then like, hey, we're meeting at so-and-so's house to play mahjong at 8 o'clock
Mhm.
after the kids go to bed. So that's been really fun way to connect with different people, but also learn something new.
That's cool. I'm definitely gonna look into
You should
mahjong.
try it.
We're
It's-
big.
it's
We
pretty
play
fun.
lots of board games
Oh,
and
you would
card
love it then.
games,
There's
so-
a lot of strategy that goes on with it. So
Yeah.
the more and more I play, the more I learn. And that actually it was kind of like my worlds colliding, right? So I'm very involved in the Cancer Support House
Mm-hmm.
and some of the events that they do, Wine and Roses event. And so one of my really good friends, her name's Erin Atkins. She runs the Social Tile. She teaches lessons, which
Oh,
is really
cool.
cool. So you can get together like a group of, 4 individuals, and she'll come into your house or come into your space and teach you how to play mahjong. So she'll do like a beginner's class. She'll do like a level 2 course where she'll teach you strategy.
That's pretty cool.
So she has started giving back to the community, though, and doing different events to help some of these organizations in the community. So like the Cancer Support House, she hosted an event there to raise money, which was really cool. She'll donate a lot of lessons to like the Fort Kids Children's Museum for their events to auction off and raise money, which has been really cool. So using her talents and using these fun events for good, right, has been
Yeah.
really fun.
That's awesome. So, say you and your husband get away for a date night. Where are you
Yes.
going to go for a date night?
Ooh, that's a good question. I love to start at Unwind over
Okay.
in Chaffee Crossing.
Oh,
That's
yeah.
a really cool place if you haven't been there. Beautiful, kind of like swanky vibes with
Yeah.
their furniture and their decor, which is really fun. So we'll get like a flight. You can do a flight, which is
Yeah.
really cool to taste new things. So we'll go maybe start at Unwind. We love Piatto. They have really good the
Mhm.
focaccia bread. So I'm big into sourdough as well.
Mhm.
It's another
Okay.
one of my hobbies. So I love their focaccia bread and their pizza. So Piatto is one of my favorites. Uncorked is always so good. We love
Mhm.
Uncorked. They're just consistently good every time you go.
Yeah.
Mhm.
I love the patio at Stonehouse though, those heaters when it's cold
Yeah.
outside. So Stonehouse has a great patio, great vibe to go hang out with. So those are probably my top 3 if we're going out for date night. And then we'll end maybe with a dessert from Crumble or something like that.
Yeah.
Oh yeah, Crumble. Man, I need to get out to Crumble more often. Have you ever had Crumble cookies?
Of course I have.
Okay.
Yes.
Hasn't had
Who hasn't had
It's
Crumble
It's probably a good
cookies?
Okay.
thing that you don't.
It's like
frequent.
crumble and then like nothing bunt
Yes.
Oh yeah, that's true.
cakes.
Yeah.
Close. Yeah. I don't
Yeah.
know that I could pick a
Yeah.
favorite.
Yeah.
There's like, but you have to look at the flavoring.
Because they both seasonal.
Yes,
you gotta
they have
see
seasonal
what the
options
flavors
and
of the
yeah,
week
but-
are. Yeah.
Yeah,
Absolutely.
it's a whole
That's
thing.
awesome. That's awesome. Well, thank you so much for being on the show today and talking a little bit about your work and about your life and giving us some great options for date nights and taking the kids out and stuff like that too. So thank you so much, Allie. We really appreciate you.
Absolutely. I've enjoyed my time. Thank you guys.